We know that diabetes affects foot health, and the reason is because diabetes affects the nerves in the feet and it affects blood flow.
If somebody has a peripheral neuropathy, you have a lack of sensation in your feet, and you are walking, there's a tack on the ground and you step on the tack, and while you're barefoot you may not even realize you stepped on a tack. If you have a sore on the bottom of your foot, which can turn into an ulceration, in order for these wounds to heal, you need to have adequate circulation.
Foot problems in patients with diabetes can be as simple as dry skin, cracked skin on the heel. It can progress further from there to cuts that don't heal, to outright ulcers that maybe even can go into the muscle layer or to the bone.
If an individual has a bunion deformity where there's a protrusion on their side of their foot and you put your foot into a shoe that's a little too snug and not fitting well, and you have a lack of sensation and you get a lot of pressure and rubbing there, you could develop a sore on the side of the foot overlying the bunion, which could lead to an ulceration.
I not only send my patients to podiatrists on a regular basis, especially if they've had diabetes for a number of years, but I also reinforce healthy foot care at every visit. That would mean washing your feet regularly, not walking barefoot, wearing comfortable socks, making sure that your shoes fit properly, examining your feet daily. I have them use moisturizer on their feet just to prevent cracked skin from developing and to bring problems to someone's attention sooner rather than later.
Patients with diabetes should be seen regularly for foot evaluations. When we do the examination, we're checking circulation, we're checking skin texture, we're checking to see if there are any cracks. We do a neurological examination, and what that means is we test to see if the patient has sensation in their feet.
The topic of amputation is a sensitive one for my patients with diabetes. I start out by talking about good glucose control, and we go through the data that we know about risk reduction. So I tell them for every 1% A1C reduction, or hemoglobin A1C, that they have, there is a significantly lower risk of foot amputation by about 40%.
The key with all diabetic patients is prevention. In order to prevent foot problems, number one is keep your sugar under control. You should see your primary care physician on a regular basis. You should see your endocrinologist on a regular basis, and you should see your podiatrist on a regular basis.